I'm Jesse Crouch. I'm the Garden and Wellness Program Coordinator at Alliance Medical Ministry.
I'm Catherine Holding, and I'm the Director of Development and Communications at Alliance. So I oversee all the fundraising for our budget. We're about a $1.6 million organization.
So we're a partner in the Raleigh Food Corridor, which is really a movement to help connect people, places, and ideas to just help develop a food system that works for everyone. And so specifically, we're one of their pilot sites for Nutrition Hub. And so being a place that already provides and co-locates several resources like doctor's office, garden education, food education. And so we're hoping to expand on that and bring in just more partners and kind of connect some dots to be able to, we're serving a lot of the same people as different organizations, so being able to hope we can support each other in that way. Alliance provides primary care for uninsured working adults in Wake County.
Wake Medicine, the largest number of uninsured patients, they're just coming to their emergency room because they don't really have any other source of affordable health care, and a lot of folks don't know about Alliance.
We have, so there in the clinic side, we have 3 providers on staff who provide primary care for our patients, and we also offer several different specialty services. We have a full-time and part-time counselor on staff, and then we have volunteer providers come do specialty clinics like mammography, cardiology clinic. We do orthopedic clinic as well, and ophthalmology throughout the year.
We're really all about managing chronic illnesses and preventing the onset of new chronic illnesses. So we do all of these things in partnership with other entities and agencies in our community.
On the wellness side, we have diabetes education each month in both English and Spanish, and I also coordinate several exercise and other education classes. So we do a 6-week cooking class 3 times a year with the help of the Interfaith Food Shuttle. We do a gardening course with the Food Shuttle as well. And then we also offer yoga classes each week and Zumba classes each week. And we do a couple different walking programs to engage our patients in healthy lifestyles.
The nutrition, the wellness component of care that we provide is so important as a supplement to the medical care that we provide. We're seeing a lot of patients that are walking through our doors that are chronically ill. 78% of our patients have at least one chronic illness, and over half have 2. And I think if you asked our doctors, most people have 3 or more. The whole holistic approach, the wellness component, healthy eating, nutrition, exercise, all of that is really introduced. Our doctors are prescribing that part of our wellness program to patients like they would prescribe medication, but it's really neat to be able to prescribe fresh produce and say, hey, just walk right outside and there's a table, you can take home some tomatoes and cucumbers, some lettuce from our garden to make a salad tonight.
In my position, I manage a small garden and grow produce for our patients. And then, so we grow about 2,000 pounds of produce, and we'll either distribute that up in the clinic or through our different wellness programs. We have volunteer providers and things like that, so they play a really big role. And we have a lot of volunteers that come through the garden as well. And so just really being able to stay on top of that so I can focus more on the patients and helping them. And then they support our wellness programs in a lot of ways, and it's always good to have extra hands for our cooking classes, and our yoga and Zumba are totally volunteer run. Yeah, so I make most of the big decisions for the garden and kind of what we're going to grow and making sure that it gets planted and taken care of. We are transitioning hopefully more into patients and possibly the surrounding community being able to have a stake in the garden as well. Right now we have 2 and hopefully a 3rd patients who have their own space in the garden and take care of that and grow the food and harvest it for themselves. And so we're hoping to really grow that program with our Seed to Separate gardening class. For the most part right now, though, I harvest all the food and I'll distribute it either through, like I said, up in the clinic so the doctor can give patients a bag after their visit, or come to Zumba class and you get a bag of produce. Yeah, so I think the biggest thing is food education and just food literacy. So, I mean, we grow 2,000 pounds of produce, which is great, but we have 3,000 patients plus their families. So it's really just kind of the upstream hope that the education that we're providing through the produce, as far as just introducing them to vegetables. I think a big part of food security conversation that's missing is kind of like the quality of the food as well. And so just really being able to promote health through food security. And so, yeah, being exposed to those vegetables, understanding why they're important and why it's important to select them, but then also doing education around how to like really shop smart and shop well and take advantage of things like SNAP.
Exercise is a huge deal, and a lot of our patients are unable to afford a gym membership and maybe not living in a safe neighborhood with conducive walking spaces or green areas for exercise. So we try to be a place for that. We offer weekly Zumba classes with volunteer support, weekly yoga classes with a partner agency, You Call This Yoga, a walking program we partnered with Wake Med Hospital this spring for the Million Step Challenge, which was really neat. And I've spoken to at least one patient who blew it out of the water, got way more than 1 million steps, and she's no longer pre-diabetic. And so it's just like these programs are providing education, providing hands-on opportunities, providing a toolkit, and really giving, I think, encouragement and sort of a runway for patients to know that they can make changes to their lifestyle and their health outside of medication and doctor visits. Yeah.
I think we have definite health outcomes that we see, and people get excited about being outside and being in the garden. And I mean, it's hard to quantify, but and there's just a pretty special joy and privilege to be able to give somebody food and kind of touch their lives in that way. So, and I think they tell their friends, and this is certainly a place that people recognize throughout the community. People will definitely see the garden coming by, and so it's just kind of a beacon of light in some ways. Probably the biggest challenge right now is being able to identify and address barriers that patients have, and so just knowing how and when to outreach to patients to let them just really know about the programs that we offer, but then beyond that, just helping them see the value in the programs and getting them invested. And so with that, just identifying just transportation and life barriers. If they have 3 kids and are working or whatever, it's going to be really hard to come out to a program. And so, that, and just kind of back to the food security and food literacy and stuff, just trying to give our patients tools to be able to really execute healthy lifestyle choices for them.